The city's scrambling to make sure other hospitals are not going to collapse under the crushing workload they're about to take on.
We have live team coverage tonight with crews getting answers on every aspect of this monumental announcement. Here from the community it impacts most in just a few minutes. But first we begin with Rachel Aragon, live outside Grady Hospital. And Rachel, this is bad news for Grady's emergency room, which is already slammed.
Yeah, that's downtown hospital already very busy, as you just laid out. And now the CEO tells me they plan for their ER to be even busier than they were before come November 1st. But the CEO also telling me earlier that he believes that they're already working on a plan in place to make sure that patients in this area get the critical care that they need.
The closure of this hospital is going to put a lot of strain on the other health systems in this market.
Grady Health System CEO John Hoppert says one of the biggest concerns is how AMC's closure will impact their emergency room. Grady says the hospital saw a significant increase in emergency room visits when AMC South ended their emergency services. And with the downtown closure slated for November, Grady Hospital says this move will put an even bigger strain on their emergency room and possibly others.
The overall feel is that volume will be spread between Grady and Emory University Hospital in Midtown and Piedmont Atlanta Hospital.
Hoppert says the hospital is prepared and has a capacity for high-level emergency care, such as burn situations and gunshot wounds. But it's the lower-level emergencies that may take a hit.
It's the patients who are using an emergency room the way you would probably use your primary care doctor. And because their situation is not an emergency, they're going to wait much longer in the emergency room, because the urgent cases take priority.
Grady Health Systems is confident the region will step up to provide patients with the care that they need. As for what the hospital is doing between now and November 1st to prepare for an influx of patients,
we are also communicating with the primary care physicians that have been serving the patients currently at AMC to talk with them about how we can assist them in maintaining their practice and assuring that their patients have some type of transition and plan in place.
And Grady also tells me several years ago they created an urgent care center not far from the ER behind me, with the hope now to expand it, hopefully very soon, they say, to really absorb those visits when it comes to lower level emergencies. Live in downtown Atlanta, Rachel Aragon, CBS 46 News.